I'm Shira Doron. I'm the hospital epidemiologist at Tufts Medical Center.
I'm Adam Weston, one of the infectious disease doctors over at Lowell General Hospital.
Adam, the CDC recently provided additional information about the best ways to wear a mask for COVID-19 protection. You probably heard a lot about that on the news.
I did. And I think the most important thing that came out of that communication is the importance of wearing a mask as the best way to protect yourself, your patients, and your family.
They also said that masks are most effective when they fit well and don't have gaps.
Correct. And at our hospital, we already provide all of our employees, as well as our visitors and patients, a surgical grade mask made of non-woven material with a metal nose strip to allow good fit that function very well already.
Now, for employees that work with COVID-19 patients or COVID-19 suspects, or who are performing aerosol generating procedures on even non-COVID suspects, we provide an N95 mask. Those have been specially fitted to prevent any gaps between the employee's skin and their mask.
And we have found that both of these processes already work very well. The vast majority of the COVID positive employees at our institutions have been community acquired. They are not acquiring COVID within the hospital.
Now, the CDC mentioned that one way to get a better fit of your medical mask is the knot and tuck method. So I'm going to demonstrate that really quickly. Now, keep in mind that the knot and tuck method might not provide a better fit for you. You might already get a really good fit with your medical mask. But if you don't, you could try this. And the way it works is you take your mask and you sort of fold it in half a little bit, and you make a knot in the ear loop, really close to the mask itself. Do the same on the other side. And then you're going to tuck the sides in order to minimize those gaps. Use the nose bar, as you always do, to mold the mask around your nose, and use these new little ear loops to go over your ears. It's important to pull the mask down below your chin. Mold the nose again. Check your tucks. And you can see that for me, I've got a pretty good fit now with the knot and tuck method. The gaps are being blocked by the tucks. You can even see some motion as I breathe in, which is indicating a good seal.
Now, it's important to note that this may not work best for everyone. Other people may have different shaped faces that this knot technique may not work as well. So it's best to try out and see what works best for you. But the most important is having a well-fitting mask and wearing it at all appropriate times.
Now, the CDC also talked about the idea of putting a cloth mask over a medical mask in order to improve the fit. And that might be an option when you're outside the hospital.
But within the hospital, cloth masks are not considered personal protective equipment, or PPE. And given the multiple issues in terms of making sure that the cloth masks are appropriate, cleaned, standardized, that is not something that we can support at this time. We recommend, if you're having issues with fit, try the tie and tuck method, and it may have some improvement in the fit.
As always, reach out to your infection preventionist if you have any questions whatsoever about personal protective equipment.
And thank you all for all that you do every day.